Good morning. Good morning, ladies and gentlemen. Final day, the award show. Uh, we're going to start the award show by a small presentation. So let's start the video and the first few slides as well. Lights off. Next.
So Ashvin, what do we have lined up today?
I think we first have the moderators, so I want to introduce my co-moderator, Dr. Gaurav Luthra, who's been exceptional in actually organizing this FIFA. It's the film festival of the AIOS. It's been an exceptional journey with him for the past 2 years that we've been organizing this. It's very, very, very reputable, where AIOS actually brings in so many different juries, so many different categories, and really brings the whole film festival video celebration on stage. It really recognizes those producers and film organizers who have actually contributed so much to education. We all know human beings at the end of the day are visual people, and we believe what we see, we believe what we can actually touch and feel, and that's what films have done for us over the years. What film festivals do is recognize this and give back to society in a big way. So
Yeah, so it was Dr. Lalit sir's idea, I think, last year that got this off the, for AIOS. And congratulations, sir, for thinking of this. And I'd been pushing him for 3 years that we have such programs. So it needs a visionary to kind of, recognize that. And we've had amazing films. There were a few hundred films submitted, out of which 50 were listed as the top 50. And out of them, 3 categories of films were put up in those top 50, for which the 3 sessions were held during the AIOS for the anterior, the posterior, and the general category. And amazing films this year. And 8 subcategories were created out of these films themselves, and winners and runners-up based on how they did in their marking through the process were picked up. And then, of course, we have the grand prize, the CS Reshmi Award, which is going to come up right in the end. Ashwin, how was the experience going through this whole thing? And he was sitting in Brazil preparing everything. Just got back yesterday, I think.
So I wanted to ask you on candidly, I mean, we can be open and honest about this, but tell me, आपको कितना मिला इसमें से? आपको कुछ मिला है इसमें साइड में से कुछ मिला था?
This year.
मेरे को तो कुछ नहीं मिला अभी तक. अभी pocket है?
I think it's all with the jury. We were bypassed, It's all with those people right up there. So
Fantastic.
I think let's call them up.
Yeah, let's actually introduce the jury. So can we have the next slide and the next one actually? Next. These are the subcategories that we had for the Film Festival Award Show. Obviously, the 8 you see over here are there. You also have the final list of awards, and that will be the final best of the best, which is the general category, anterior segment, and posterior segment. And the CS Reshmi, which is like the grand prize of this whole thing. So can we have the next slide, where we're going to introduce and bring up the jury of this esteemed FIFA awards. Dr. Gaurav.
Yeah, so I would love to invite on stage the president himself first. Dr. Lalit Verma, sir, please do the honors. Dr. Natarajan, I can't see yet. He's, I think, on the way. We'll have him soon.
He had too many alumni parties to attend.
Yeah, last night. He was busy on the floor. Amar sir had to go back last evening. Something really important came up. We'll request our past president, COVID president, I will call him. Yeah, he did a fantastic job over the last 1.5 years that he was steering us through those troubled waters. Dr. Mahipal Sachdev. Dr. Harbans Lal, our president-elect, please come, sir. And
Congratulations.
Dr. Namrata Sharma should be here, the Iron Lady as I call her.
So as soon as somebody sees Dr. Namrata and Dr. Natarajan, please send them over.
Yeah,
So
we'll
in
be
case we
grateful
don't
if,
see them.
yeah, we might miss them. And
Yeah.
great.
Next.
So I think, sir, please, welcome.
We are missing Dr. Partha as well, even though I know he was here, yes, last night. I hope if he is, please, we would love to have him as well on stage.
Partha will be able to come. Partha will be able to come.
Thank you, members of the jury, to, help on in these trouble times, especially with the COVID causing so much ruckus and distortion of big events like the AIOS and other things over the past 2 years. So thank you, jury, for being here.
So I think
Next. Right, we have a small presentation from our sponsors. Thank you, Micro, for helping on this front. It's been a very good journey with you, and you guys do a really exceptional job of organizing this with us. So thank you so much.
absolutely. So going along, I think
Next.
we have, can we have the next slide, please?
And next, and we want to introduce our first category. So can we have the next slide? Which is the best in cataract category. And I think to do the honors for the best in category, let us call upon Dr. Sri Ganesh to give away this award along with one of our jury members.
Yeah, Sri Ganesh is himself a winner of many awards on the international arena, and it's only, and an innovator as well. So it's only befitting that Dr. Sri Ganesh does the honors for this category.
Dr. Lal, can we please have you on stage?
And Dr. Harbans Lal, of course, a pioneer cataract surgeon, one of the first guys started doing phaco. Nothing could be better. So can we have
Can we have the first award in this category is going to be, next slide, please. We have the runner-up for this category. And let's see who the winner is for this. Can we have the winner's name for the runner-up category in the best in cataract? Next slide, please. Dr. Saurabh Patwardhan for understanding the unseen universe of zonules. I wish he's here. If he's not, then we would love to know about it at least.
if he's not here,
If
somebody
somebody
else
can
who would like
accept
to.
the award for him. He was here.
He was here, I think, yes. Well, let's give the winner away first, and then
Yeah, we can
if he's here till then.
call
then
him back for the...
Yeah.
If somebody sees him, please let us know.
Yeah, just call him.
Thank you.
Can we have the winner for this category, please?
And the winner for the category in the best in cataract for the FIFA award is Dr. Kumar
Wow.
Doctor. Congratulations, sir. Can we have some music if that's possible? But Tinkles, the film which he's won the award for is called Tinkles for Capsule Wrinkles, Demystifying Zonular Support. Kumar, I know, sends a lot of videos, and I think they're such educationally high content education that you really want to go back and watch this. That's why it becomes important to know the names of the winners and the titles. Congratulations, sir.
Congratulations. I think you got this in the Ascaris as well. Great, great job.
And can we move on to the next category of the FIFA? Saurabh is here.
Okay,
Yes.
so we have the runners-up and again
Dr.
a
Kumar,
brilliant surgeon.
can you just wait for a few
Yeah.
seconds? We want to show your video. Just few minutes, few seconds. Dr. Saurabh, congratulations to winning. Congratulations to winning the runner-up in the best in cataract category.
Yeah. I'm anchoring the film festival. Okay, okay, I'll come towards the end. No, I'll come in the end. I'm anchoring.
Thank you, Dr. Saurabh. Dr. Kumar, we're going to watch your film, so can you please be with us while we play your film? Can we have the lights off, these lights? Can we play the film?
The presence of capsular wrinkles while performing capsular rhexis is a sign of selective anterior zonular weakness. Use of a cohesive viscoelastic prevents the rhexis runoff in such cases. The novel PC radial sign and the floppiness of the posterior capsule causing it to follow the aspiration probe during cortex removal are signs of selective posterior zonular weakness. This floppy posterior capsule should always be stabilized with an endocapsular ring. Iridophacodonesis, a crescent sign, and irregular anterior chamber depth are signs of panzonular weakness. Capsular hooks, Sionis, and Emmert segment should be used to perform a safe in-the-bag phacoemulsification followed by an IOL implantation in such cases.
Thank you, Dr. Kumar.
Congratulations.
Our next category is a very important category. Thank you, Dr. Sri Ganesh, for being here. Our next category is a very important one. It's called the cornea and ocular surface. And I think it's an extremely growing field. Very important to kind of recognize people in this field because there are not too many, but the people who are doing this job is an exceptionally important work. I definitely want to take this opportunity, Gaurav, to actually congratulate not just the winners and runners-up for today, but every single film producer who has actually submitted a film, regardless of winning. Believe me, we've seen these films. It's a marginal difference between the two, and honestly, somebody's got to get it, and that's why these people are winning it. But honestly, the educational content that the FIFA or the film festival has been growing over the years has so much content over there that, believe me, it's going to be a mammoth task to overcome this next year, and that's best part of this whole journey for both of us, at least when we watch these films. Coming back to the award ceremony, we have cornea and ocular surface, and we would like to call upon Reshma to give away these awards along with one of our jury members, please. Thank you, Reshma, for doing this. Actually, in fact, we can have all three of you on stage. It'll be better. Yeah, it's better that way. Yes, I agree with you, sir. So can we have the first award in this category is the slide.
So the runner-up is?
Slide, yeah, the runner-up. And the runner-up of the first of this cornea and ocular surface category award goes to Dr. Lionel Raj, please. Congratulations, sir, for the film Antimicrobial Lake. Thank you, Dr. Lionel, for being here.
Congratulations.
Dr. Reshma, please stay back. We have our final winner for the cornea and ocular surface. Can we have the winner's name, please? It is Dr.
None
Samar
other
Basak,
than Dr. Samar Basak,
who's also
our
won the
new,
elections.
Vice President.
BCL interface technique of DMEC graft preparation, doubling the utilization during COVID-19 pandemic. I'm sure that Dr. Samar is busy receiving some congratulations somewhere in this Congress.
Can we have somebody pick this up on his
but we-
behalf? Else I'll I have to request one of the AIOS office bearers. Anybody from Disha here today?
Please, thank you so much.
Inform किया हुआ है. Inform किया हुआ है.
You have to take the photograph as well.
Great. Can you please run the video?
Please?
Here we describe a novel BCL interface technique of donor preparation in DMEC. The tissue is first placed on a Teflon block and a 9.5 mm partial trephination is done. The DM graft is gently peeled almost entirely, leaving behind a 1 to 1.5 mm hinge. We then move to a second Teflon block where a BCL is placed and refined to 12 mm. A 3 mm central or slightly eccentric punch of the BCL is done. The trimmed BCL with central window is again stained with trypan blue. This is then placed onto the stripped part of the donor corneal stroma. Very carefully, the stripped DM endothelium is floated back on the BCL surface. The hinged part of the donor graft is then separated. Now the BCL supported tissue is flipped over and the S-stamp is placed as usual. The DMEC graft is carefully transferred to the cup of the donor tissue. The stamped graft is now ready. The remaining anterior part of the donor tissue is then kept back in the preservative media.
Congratulations, Dr. Samar. Dr. Reshma, thank you so much for being here.
Thanks, Rishma.
And we have our next category, which is the best in refractive surgery. And to give away this award, can we have Dr. Kumar, Doctor, please come on stage and help us give this award away. For the first award in this category, we have the runner-up in the refractive category, surgery category. Can we have the name of the runner-up? Dr. Jeevan Ladi for his video on para-incisional quadrant saving dissection with reverse pull in small incision lenticule extraction. Congratulations, Dr. Jeevan. I see Dr. Jeevan has chosen the right side to come because he sees the champagne bottles there.
Congratulations. Thank you.
Thank you, Dr. Jeevan. And for our winner, can we please have the winner's name in the best in refractive? Dr. Sheetal Brar, yet again. She wins too many of these awards and it's getting too many times, it's getting a habit now for her. But her video is called the Help Me in I'm Stuck, Techniques and Tips for Managing Retained Lenticule in Smile. Sheetal, congratulations. Yet another feather in the cap. And please don't leave the stage, we need to see your video. Can we play the video please? Are the lights off?
Wait.
Don't go. Next.
Management would depend upon size and location of the retained tissue, clinical presentation, as well as experience of the operating surgeon. Careful decision making in these challenging scenarios of smile and timely referral when needed may not only help in faster visual recovery but also put back the lost smile on both patient and surgeon's face again.
Congratulations, Sheetal. Thank you so much.
Congratulations.
And Dr. Kumar, thank you for being here. We have our next category is the best in new technique category. And to give away this award, can we have Dr. Jeevan Ladi to come and help us give away this award? And we have our runner-up in this category. For the runner-up, can we have the name for the runner-up in best in new technique, please? Dr. Karan Bhatia for mixing complex DSEC and SFIOL. Congratulations. So the runner-up goes to Karan Bhatia for this amazing video. Please go watch it. Congratulations, Dr. Karan.
And the winner for the best in new technique. Can we have the winner, please? Next.
Next.
Smita Kapoor, muscle transplantation and sensory exotropia, a case series.
Dr. Smita, if somebody is not there, can someone collect it for her? We can always send it out, no problems. Just for that, we're going to have you on stage for yet another category, please. So let's move on because we'll send this award obviously to Smith's place.
Can we have the?
But we'll have a look at her video because this is the winner in that category.
This video showcases the results of 5 patients of sensory exotropia in whom true muscle transplantation was performed.
Dr. Grover is
In
here.
this technique, sutures are first applied at the rectus muscle insertion and at a point where the muscle needs to be resected. Similarly, the other rectus muscle insertion is also sutured. The desired amount of resection is then performed, and the resected portion of the muscle is transplanted to the other horizontal rectus. This is followed by conventional recession and resection techniques. In esotropia, the lateral rectus is transplanted to the medial rectus, and in exotropia, the medial is transplanted to the lateral. The patient was orthotropic on the first post-operative day. At 6 months, he maintained good alignment and full motility.
We have the legend himself to come and collect the award. Thank you so much.
Congratulations, sir. I don't see her. Yeah.
Come, sir.
If she's here, we should call her.
Thank you, sir.
Thank you.
Thank you, sir. Thank you,
We'll
Dr.
request
Jeevan.
sir to stay on and give away the next award. Oh, sir, we'll give his award now. Yes.
Give it after
Huh?
this category.
After this, yes.
Yeah. So for our next category is the best in vitreoretinal surgery, and I think to give away what we already have Dr. Grover here. So let's move on with the runner-up. The runner-up in this award category goes to Manisha Agarwal for the hidden needles. Is Manisha here?
Dr. Manisha Agarwal from Delhi.
Okay, is anybody willing to accept this award for her and give it out to her? If not, we'll move on in interest of time because we've been clearly told about a timeline that we have for this award show.
Somebody from Shroff Charity who's here, or anybody from Delhi who can take this and pass it on to her?
Is
I
Manisha
think I
Agarwal
can
here?
see her, yeah, I can see her.
Okay, fantastic, she's here. This is the runner-up in the Best in Vitreoretinal Surgery category. Congratulations, madam. Moving on, thank you so much, ma'am.
Congratulations.
Moving on to the winner in this category, we have the winner Vishal Raval for en bloc resection of a large retinal capillary hemangioma. Vishal, congratulations. Congratulations. And Vishal, please stay on stage. We want to see your video. Yeah, can we play the video, please?
A 42-year-old female patient was referred for left eye retinal vascular lesion. The surgical steps are as follows. Adherent membrane and epiretinal proliferation overlying the tumor area were peeled with forceps. Cautery diathermy was applied 360 degrees around the tumor area. Bimanual scissors and forceps were used for the separation of the tumor from the surrounding retina. The undersurface of the tumor was adherent to the choroid and separated with scissors. Nasal
We are calling you
sclerotomy
right
was
now.
extended to 5 to 6 mm and the tumor was delivered
5
by
seconds.
increasing
5
the
seconds.
intraocular pressure. Here you see the reddish hemangioma about 4 into 3 into 2 mm in size. Fluid air exchange was done and the retina settled well. Air silicone oil exchange was done. Post-operatively at 1 week, the retina was attached with laser marks as seen and silicone oil in situ. Histopathology showed mononuclear round cells with proliferating blood vessels in a fibrillary and collagenous background suggestive of retinal capillary hemangioma.
Congratulations, Vishal.
Thank you.
Dr.
So,
Grover, we just want you
We
to
have
stay here
Dr.
for some
Basak sir here finally with us. Sir, please come on stage. We've announced your award already, and please come and do the honors.
music.
Double congratulations, sir.
Congratulations, Dr. Samar.
Sir, you will be receiving this award
So,
another category also.
And Dr. Grover, thank you so much for.
In another category. No, no. He's
Dr.
going to
Grover,
receive
thank
it
you so
again
much.
In another category. These are the 8 categories, and then in the NTA category again you are winning. Yes, yes, yes.
Best in Instrument and Devices is our next category. And in order to give away this award, can we have Dr. Surya Jain? Is she here? I know she was here. No? Okay.
Dr. Samar Basak. Sir, Dr. Basak, please come back. We want you to give away this next category of awards, please. So the next category is Best in Instruments and Devices. So we all know that there are lots of new instruments coming up all the time, and people are innovating and with devices and everything. So can we have the runners-up for the Instruments and Devices category, and to give it away, we'll have Dr. Basak sir to do the honors there again. So can we have the runners-up, please? Dr. Rajendra Prasad. So again, he won at ASCRS as well this year. So his film on sewing needle microcapsulotomy to avert Argentinian flag sign. It's an innovative film. And do we have Dr. Rajendra Prasad here? I don't see him. Can somebody receive it on his behalf, please?
It's fine, we will send it over. Can we have the winner in this category of Best in Instrument and Devices? Winner is Mimansa Agasti for innovative model for vitreoretinal training during COVID times. Is Mimansa here? Dr. Natarajan, can we please have you on stage because you're one of our jury members.
Would anybody like to
Mimansa here.
receive this award on behalf of Dr. Mimansa?
Let's have a look at the video because it's a very interesting video. So let's have a look at the video, please.
Innovative models for vitreoretinal training during COVID times.
We describe a simple, customized and cost-effective eye model for retinal lasers and VR surgery. We describe the Retilab eye model. The eyeball framework is done by cutting a ping pong ball in half. An aperture of 5 to 6 millimeter is made in one of the hemispheres which simulates pupil. An A4 sized drawing paper is chosen and a retinal diagram with the desired lesion is created on Microsoft Paint or similar program. The image is stored in a portable graphics format and 9 copies of the retinal diagram can be printed per A4 size paper. The retinal diagram is cut in the form of a circle. 4 slit-like apertures or wedges are made in the corners and assembled inside the ping pong ball. And regular contact lens for laser photocoagulation is used to practice lasers. The used retinal film can be replaced by a new one in the same framework. It is very cost effective and the burns produced resemble those on human retina and power settings are comparable to real life scenario. Focal, grid, barrage lasers can also be practiced on the same.
Congratulations, Dr. Agasti, for this amazing video and presentation on this. And we'll still have you on stage because I don't think...
Can we go to the next category, please? So, best in quality teaching. And can we see the runners-up? Next slide, please. So, the runners-up in the best in quality teaching. Now, this is a very important category and some very good films are there in this category because they kind of go into depth of how to explain a particular subject. Can we have the runners-up, please? So, The Art of Successful PVD Induction by Dr. Meena Chakrabarti.
Congratulations, Dr. Meena. Congratulations, ma'am. Please. Thank you, madam. Can we have the winner in the best in quality teaching? Next. And the winner is
Divya Trivedi. So, Dr. Divya, she's here for the film Customized Phototherapeutic Keratectomy for Recurrent Corneal Erosion Syndrome. Do we have Dr. Divya here?
Can somebody collect the award? Okay, let's have a look at the video by Divya because it's a very interesting video. Can we play the video, please?
Customizing phototherapeutic keratectomy for recurrent corneal erosions. A novel technique. We applied this to several cases in our practice and saw promising results. We ablated lesser tissue, saw no refractive surprises, and had no hyperopic shift among the operated eyes. In conclusion, customized PTK is an effective tissue-sparing technique for the treatment of RCE syndrome that can be safely performed in eyes refractory to the conventional methods of therapy.
Congratulations, Divya, on this amazing video. And we're moving on to the next category. And Dr. Basak, thank you for being here for for this amazing award category. Thank you. Thank you.
Thank you, sir.
We'll call you back
We
on
are
stage.
waiting
You're
for
not
you.
going anywhere. Best in special interest category is our next one, and to give away this award, can we please have on stage? Now I'm looking for people, Gaurav sir. This is becoming.
We have stars here. Dr. Natarajan is going to give this
Yes.
away.
Okay. This
Yeah.
is Dr. Natarajan's show now. But best in special interest category, can we have the runner-up in this category, please? The runner-up goes to
Next slide, please. Hirika Gosalia, ASPI anterior segment photography with intraocular lens for residents, an innovative learning tool.
congratulations. Music?
Ladies and gentlemen, it's your boy Luthra.
Erika, congratulations on this film.
Yeah.
Moving on to the winner in the best in special interest category, can we have the winner's name, please? And the winner is
Dr. Kasturi Bhattacharjee, emerging digital technology for precise orbital surgery at the micro scale beyond current confines. Again, an amazing film.
okay, fantastic. And let's watch this amazing film before we. So, can we have the film, please?
Emerging digital technology for precise orbital surgery at the microscale beyond current confines. The software equips us with tools for differential color coding, precise marking, and mapping of the site of pathology with accuracy. Manual segmentation is a time-consuming task, whereas auto-segmentation of the area of interest followed by the use of mirroring feature involves the superimposition of the contralateral normal orbital skeleton onto the disrupted site, which finds its use in unilateral disorders. The CT images are loaded twice, merging the mirrored orientation onto the original. This helps identify the exact measures of the defect and quantifies the displacement. Based on this preoperative planning, we can design a patient-specific implant to replace the defect and provide the required support to the fractured orbit. This heralds the advent of a new era where technology will pave way for an avant-garde approach on the landscape of orbital surgeries. The digital evolution is a work in progress which is headed straight for the stars. Thank you.
Congratulations, ma'am, on this amazing film. Moving on to the next category. And now we are coming to the best of the best. Before we move on to the best of the best, we wanted to actually have a small little bit of celebration. I think it's important that we celebrate a little bit right now.
Absolutely.
Before we move to the best of the best. So we're moving on to the most interesting part of this stage, which is on this side. Can we have our jury members please come here, join us? We are
And we
obviously
can
going
have
to.
the
It's
newly
nothing but
elected vice
continuation of
president also.
last
Sir,
night.
please
So
come. Basak sir, come. A little bit of celebration.
So we're going to open one of these right now. I'm clearly seeing who's going to open it.
1 minute, let him come.
नहीं, नहीं.
Maipal sir is an expert on this. Oi.
Oh, Congratulations to all the winners and all the producers of every film that has been submitted to the FIFA. It's an exceptional journey for... I'm here. Congratulations, guys. We're not done. There is the best of the best, so just hold your seats. We still have a few more awards left.
So going on to the next set of awards, we are almost coming towards the grand finale. And now the three categories, which are the AIOS categories, we will be honoring the winners and the runners-up of the three categories, the interior, the posterior, and the general category. Can we have the next slide, please? Next slide, please. So in the general category, Ashwin?
All yours. So we have the general film, and the best in general film. Can we have the runner-up, please? The runner-up in the general film category is Dr. Jyoti Matalia, All You Want to Know About Optic Nerve Sheath Fenestration. Who is
Can we
coming
have
to
somebody come and collect this?
Somebody clapped. I saw
Anybody
somebody
from
clap.
Narayan
All
Netralaya
those
here? So maybe somebody ex-Narayan Netralaya, I see Rohan there. You can come take this for Jyoti, maybe.
Come, come, come. Thank you so much. Dr. Maipal sir is going to give this award. Guys, go watch these films. They are exceptional, really educated films. Thank you so much. And moving on to the winner in the best in general film category. Thank you for doing this. And the winner in the best in general film category goes to Dr. Kasturi Bhattacharya again.
Yeah. So Dr. Kasturi Bhattacharya, that tells you about how the
good
film,
this
how
film
amazing
was.
the film
Yeah.
is. Same film,
So
yes.
we're going to move on because we've already seen this film, and I think unless Dr. Bhattacharya is already here.
I don't see her, so
No,
we can go on.
She's here, but I think she's in another. Is she here?
Yeah.
Same film.
So in different categories. Different categories. Like AIS 15 categories है ना और बाकी आठ.
Correct. Best of the best.
पहले सब categories थी, सब broad. एक तो ऐसी सब.
In interest of time, we are not going to watch this film again, but we are going to move on to the next category, which is the next. Can we next slide, please? Best in anterior segment, and the runner-up, and for giving away this award, we're going to have Dr. Harbans Lal give this award away. For the runner-up in this category goes to Dr. Kumar Doctor for Tinkles for capsule wrinkles, demystifying zonule support. We have obviously his. Please come, Dr. Rashmi. Here,
Runners-up.
this is the runner-up in this category. So congratulations, Dr. Kumar. Thank you for doing this. And our winner in this category, in the best in anterior segment FIFA, goes to Dr. Samar
Dr. Samar
K.
Basak
Basak.
again. Wow. That's amazing.
PCL interface technique of DMEC graft preparation, doubling the utilization during COVID pandemic. Congratulations, sir. And please don't leave the stage. We want to see this film with you on stage. So last time we didn't do that. So congratulations.
तो आप दोनों को आपके मुंह में घी शक्कर
Okay.
Here we describe a novel BCL interface technique of donor preparation in DMEC. The tissue is first placed on a Teflon block and a 9.5 mm partial trephination is done. The DM graft is gently peeled almost entirely, leaving behind a 1 to 1.5 mm hinge. We then move to a second Teflon block where a BCL is placed and refined to 12 mm. A 3 mm central or slightly eccentric punch of the BCL is done. The trimmed BCL with central window is again stained with trypan blue. This is then placed onto the stripped part of the donor corneal stroma. Very carefully, the stripped DM endothelium is floated back on the BCL surface. The hinged part of the donor graft is then separated. Now the BCL supported tissue is flipped over and the S-stamp is placed as usual. The DMEC graft is carefully transferred to the cup of the donor tissue. The stamped graft is now ready. The remaining anterior part of the donor tissue is then kept back in the preservative media.
Congratulations, Dr. Samar. Congratulations.
So I think Dr. Kumar wants a picture with his award. Come.
Please come, sir. Well, it is. Congratulations.
I'll now like to invite Dr. Lahane, sir. I see him. He's finally here. Please come, sir.
Dr. Lahane has come at the right time to give away all the final awards for this FIFA award category. So we have the best in posterior segment now. And moving on, can we have the runner-up in the best in posterior segment? The runner-up goes to, oh, it's a double whammy.
Wow.
It's a Chaitra Jaydev and Mimansa Agasti for their films. Both have won a tie, and it's called Retina Ripples, COVID Risk During Vitreoretinal Surgeries and Innovative Models for Vitreoretinal Training During COVID Times. Congratulations to both of them. If any of them are here, we're happy to, give away the award, but if not, we will send the award.
Anybody, I know Dr. Mimansa is not here.
Yeah,
Anybody
Mimansa
for
is not
Dr. Chaitra?
Is Dr. Chaitra here? Okay, let's move to the winner in this best in posterior segment. The winner in the best in posterior segment goes again to Vishal Raval, who has got the video for end block resection of a large retinal capillary hemangioma. Music, please, and congratulations, Vishal, once again. Congratulations, Vishal. Already seen the video with him. Can we move to the next category? Yeah.
Okay, so I would like to clarify here that because of some of the circumstances last evening, we will not be announcing the CS Reshmi Award. We are only announcing the grand prize for the winners amongst all the things. CS Reshmi will be announced separately by the AIOS. So this was the winning entry for the grand prize. For the grand prize here.
Grand prize of the FIFA
And for this we need to pop the champagne as well. But let's see who the grand prize winner is.
And the grand prize goes to Dr. Kasturi Bhattacharjee for her video on emerging digital technology for precise orbital surgery at microscale beyond current confines. But I know she's not here, We would have loved to open the. Yes, champagne. Some more.
अब लाने सर खोलेंगे, ललित सर खोलेंगे.
गौरव सर बोल रहे हैं जो भी खोलना है खोल दो, मुझे पीना है. Congratulations, Dr. Kasturi, for this amazing film, and congratulations to every jury member who's been on stage with us. So thank you so much for being here.
The champagne.
It is such
Lalit sir has to pop the champagne.
Dr. Lahane, can we please have you open this? यहाँ से खुल जाएगा. There's a strip here, sir. एक मिनट. नहीं सर, वहाँ से नहीं हो रहा.
Shake it. Yeah.
At this point, I want to congratulate every audience member who's been here. Honestly, I know it's a Sunday morning, but thank you so much for being here.
Shake it.
These visuals you won't get again.
Dr. Mayupan looking come.
Next time खोल के रखना.
Oh God.
Sir, hard nucleus or hard bottle?
लाने से hard brown cataract. This will make for a good OPL video. Oh God. होने वाला. अशोक क्या करके आया? सर फेमटो चाहिए या SICS चाहिए?
अगले फिल्म फेस्टिवल में यही अवार्ड मिलेगा. This will.
Hard cataract. Oh, that's great. Wow. सर को तो देते हैं, सर ने तो लिया ही नहीं. सर के लिए.
Oh my God.
सर
मर गया.
बाकी सब तो पकड़ लो. Cheers. सर
Let's get a picture, guys.
Yes.
Yeah, they've been superb. They've been superb. Next.
अल्कोहल नहीं होता.
नहीं sir. Can't.
So thank you so much, everyone, for today's program, and I would like to thank Microvision as well for their support in organizing this. I would like to thank all the jury, all our dignitaries on stage for being here with us, and all our audience as well. Thank you so much, and congratulations to all the winners. Until next year.
And thank you, Dr. Gaurav, for co-moderating with us. Thank you. Lalit sir,
Can we have
all
a
your
group picture,
brainchild.
sir?
Congratulations. Thank you so much.
You are also nice, but only which was the active.
अरे नट्टी का रिसेप्शन कमेटी का पिक